This is going to be a fast-paced session about things that are going to surprise us about how we're going to consume healthcare in the next few years. So with that, Don, thank you so much.
What I was asked to talk about was to give you ideas about 5 ways you may consume healthcare in the future. So I've got 5 different ways that I think you're going to consume healthcare in the future.
There you go.
So one of the first ways is the increased use of sensors to give us feedback in ways you may find to be a little unexpected. Many of you have obviously seen the stories about Apple and the Apple Watch and the ability to move ECG. Apple unfairly took credit for doing that. They were not the first company, even though that's what they told everybody on stage. It was a company called AliveCore that actually did the initial work and breakthrough. And what AliveCore has done is stayed on the AI front. And recently, they finished working with Mayo Clinic, taking 1.3 million patient records who had had their ECG measured and potassium levels measured within 3 hours. They went through those records and now are at the FDA with the first claim to be able to measure potassium, normally done by blood, on your Apple Watch or on your watch with the AliveCore function to get the potassium levels without any blood being drawn.
So you can get let me understand this, you get the potassium levels and the EKG.
EKG and diagnoses if you happen to have atrial fibrillation. So this is an example, and I can tell you there are a number of other lab values that they believe are buried in the ECG that they're going to continue to mine. So this is radically changing the process. Not only do you have your potassium level with you at all times, which is crucial for a number of clinical conditions, but it's real time. So this is a big change. It was big enough that the FDA gave a preferred status, so they basically got front of the line status at the FDA. It's called breakthrough status in order to get approved. So we're just right now waiting for the approval, but the work's done. Interestingly enough, when they went to Mayo Clinic, they let the doctors get involved, and the doctors took the list of patients that were in this database and said, well, you don't really want the really sick ones. Well, let's take them out. And you don't really want the really young ones. Let's take those out. And they gave them an edited list. And when they ran the first AI work, it came back as crap. There was no correlation. They went back and said, let's just give us all the data. Forget it. And when it came back, they got almost a perfect correlation line. There's going to be a common theme of what I'm going to say is sometimes doctors don't know best.
All right, number 2.
Number 2.
That's my role. I'm just counting.
Amazon. So what kind of influence is Amazon going to have on us? Well, there's going to be a number of areas. They're going to get into the pharmacy business. They've bought the assets necessary to build out a very comprehensive. They bought PillPack, not because their pills are going to come to us in little packs, although some people might get them that way, but mainly because they wanted the software infrastructure that PillPack had, which was modern software, as opposed to some of that ancient stuff some of the other places use. And they also wanted the licenses that they had in 49 states to sell, to be a pharmacy. But here's where Amazon's really going to be a game changer. 110 million households in America are Amazon Prime customers. Do you think Amazon's going to ask you if you want them to ship you your medications if you say Amazon at the doctor when they write the prescription and just say go ahead and ship them? You're going to say yes. What's that mean? That means Amazon's going to solve something called the first fill problem. Between 22 and 34% of all prescriptions never get filled. People don't bother to pick them up. Do you think the pharmaceutical companies of America and Europe are going to be racing to Amazon's door to help them get people to say Amazon instead of Walgreens and CVS if they can solve the first fill problem? That's a big change. What else is Amazon doing? They're taking, as of the beginning of this month, they're taking FSA and MSA debit cards. They have a whole list of items that are approved that they're now selling, and they're basically saying, pull out your employer's given cards and buy here. What else are they doing?
So is that 3 or is that you're still on 2?
No, I'm still on 2. I'm just talking about how Amazon's gonna...
Just checking.
And then, how many of you know that there's Amazon Prime for Medicaid? Half price. If you're on Medicaid, you can get Amazon Prime for half price, which means you're gonna be able to get your drugs in a movie.
All right, number 3.
The next area is what I call the parsing of medicine. So if you think about services that you've all been exposed to one way or another around what telemedicine is. Call a doc, ask questions, maybe get a diagnosis, maybe get a prescription. You marry it with direct fulfillment, repackage it with a cool brand, package it with cool packaging, the way Apple would package, and then just take one little tiny slice of medicine and launch a company around it. So let me tell you, I'm going to read you off a bunch of companies that have launched in the last 12 months that have raised $1 billion that are doing exactly what I've said. So you can look these up. You can look up Roman for ED. You can look at Hers and the Pill Club for birth control. These are branded operations. Call them, never leave home, and have the drugs that you need as a part of this delivered the next day. Hair loss, Keeps. Migraines, Cove. Smoking cessation, Zero. Anxiety, Kick. Derm, this one's cool, Yo Derm. Diabetes, Onduo. These are all nationwide medical practices that are attacking one little tiny slice of medicine in a way that's convenient. And what they're really doing is they're saying, none of us, when we go to the doctor, get what we really want. We want a solution. We didn't go to the doctor to get an opinion. That's just kind of one little step along a path. We want a whole solution. They're delivering an entire solution, if you know what the problem is. So these companies have raised $1 billion in the last 12 months.
Wow. Number 4.
Sensors. Sensors used without any clinical information. We did an experiment, and it worked out beautifully. We took GE and Rolls-Royce and some other jet engine company sensor analysis software that analyzes the sensors from the jet engines and determines whether the machine is in the norm or non-norm status. Think whether it's operating as it's supposed to. And what they found in that industry is every engine has its own normal status. They're not the same. And then if it goes off normal, you better look into it. So we applied that technology to patients in Sierra Leone exposed to Ebola. And the challenge was, see if you can monitor the patients, figure out when they're going to decompensate, before they decompensate, and do it in a way where the healthcare professionals don't get exposed to the virus. So we did that with a smart Band-Aid, a peel and stick Band-Aid that measured 8 different things, put it in a jet engine analysis, and found out decompensation 9.5 days before it happens. No clinical symptoms. The doctors all said, we can't treat anything, we don't see anything. We said, well, we can see it right here. It's been proven and validated. So now we have to make up cocktails, drug combinations to prevent the decompensation from actually happening. And that's another example of, this is without any clinical input whatsoever. We just looked at, is the human in its norm or non-norm status? And then finally, digital therapies. Drugs on the internet, the IoT of drugs. Everything else is on the internet, why can't your drug be on the internet? One of the first ones approved by the FDA is MySite. It's a recasting of Abilify, which is a generic drug for psychotic patients. It now has a chip in it. When you take the chip, your stomach activates the chip so it actually says, I arrived. It's received by a little patch you wear on your stomach, which then connects to your phone. Patch has other sensors. That same technology is being used in San Diego, LA, and Orange County for TB, for public health TB patients. And both LA and Orange County have announced they're going to switch over to that technology and get out of using direct observation therapy, which is the global standard. So digital therapies are coming a long way. Those are just 2 examples, but there's many, many more of connected drugs. And I think that's going to be, you're going to go to your bathroom and your drugs are all going to be on the internet.
Okay. That's a horrible visual, but okay.
If any of you are curious about it, I can tell you I'm currently working with about 24 different products in that.
One thing that I have to tell you, I've known Don for a long time, and every time I talk to him, I just learn something new about what's going to happen in healthcare and what's going to happen at the pace of change is just incredible. And I think if there's one sector that we all agree needs to be disrupted in a good way, it's healthcare. Because as the speaker last year said, the CEO of Heal, he says, I've never seen a sector where every single stakeholder is unhappy. Physicians are unhappy, payers are unhappy, patients are unhappy, employers are unhappy. Like, how can it be that nobody's happy in the sector? At least somebody's got to be doing well. And with people like Don and sort of the other, we heard from Abbott Health and others, there's a lot of upward movement, I think, in solutions in healthcare that's the one thing that benefits all of us and we can all be engaged in. So Don, thank you so much for your time.
Welcome.
And appreciate it.